Megacast TV, your channel of choice. Please like, share, and subscribe.
Hello and welcome to another edition of Megacast TV. My name's Jake, and as you know, Tracy's not here at the moment. I'm sure I will stop saying that eventually. She's going to be gone about 6 months. But I'm joined by my friend from across the pond, the lovely Beth. Good evening, Beth. How are you?
Hello, I'm good. How are you?
Yeah, I'm pretty good. So we've been talking about what we should be doing for shows, and you came up with a few ideas, didn't you?
Yeah, I did.
So that's kind of cool. Saved me doing it.
Well, it's more just, I think, my natural curiosity about the differences between UK and America.
Right. Okay. So today we're going to be talking about the differences when it comes down to sort of healthcare.
Right.
Okay. Cool. Let's shoot this baby.
Sounds good.
So, do you want to go first? Do you want me to go first? Do you want to swap in between, or? I mean, I've got slides.
Okay, I'll let you go first. I think really why this came up for me is because of the interest for the UK with the free healthcare. And I'm interested about how that's different from America.
Right. And please forgive me if I'm speaking out of turn, but you're an ex-veteran.
Yes, Army veteran.
So does that mean you get? We can talk about this in length shortly, but does that mean you get some free care too, or not?
Right. So if I want to use that, you're not forced to, veterans or not, but anytime you serve and you get an honorable discharge, you can use any of the military veteran associations, which are known as the VA.
And are you honorably discharged?
I am, yes.
Ah, okay. So we can talk about that shortly then. That's cool.
Right, yeah.
Yeah, cool. Okay. So what I'm going to do is I'm going to talk about the US, the difference. What I'm going to do is talk about the differences sort of really between private and the NHS. There are a few differences here in the UK, and you really only get NHS healthcare if you are on certain kinds of benefits or receiving certain kinds of, and by benefits I mean government help. So it would be things like maybe
welfare or
welfare.
Yeah.
That's right, yeah, welfare. Okay, so I'll start with my little slides because I'm good like that.
Nice. Very profesh.
Oh, of course, darling. Right, so this is the dental and optical UK charges, NHS versus private. All right. So with the NHS bans when it comes to dental, there are 3 NHS charge bands. So band 1 covers an examination, diagnosis and advice, and if necessary, it also includes x-rays, a scale and polish, and planning for further treatment. That's £23.80. So that's basically just a basic examination with a scale and polish, right? Then we've got band 2, which covers all the treatments in band 1, plus things such as fillings, root canals, and removing teeth. So in the UK, unless you are receiving specific benefits, you have to pay for NHS treatment. But the NHS treatment is cheaper than it would be if you went privately.
Okay.
But you only have to pay for NHS treatment, as I've said, if you're not receiving certain benefits and welfare kind of stuff going on. So band 3 is £282.80, and it covers bands 1 and 2, plus more complex procedures such as crowns, dentures, and bridges.
Now, is there like an unlimited cap on that each year? Like, let's say 1 year I would need 1 crown, and then maybe the next year I would need 5 crowns.
It's unlimited.
Okay.
So if you needed 5 crowns, then you would still pay the basic NHS price of £282.80.
Okay.
Yes. Now, this versus private, for a new patient consultation or band 1 privately, you'd be looking anywhere between £20 and £120, depending on what you had done. Now, the reason for that is their kind of scale and polish that they would do during a band 1 consultation is a lot deeper than it would be if you went for a band 1 NHS scale and polish.
What is a scale and polish? I mean, I think I know a polish, but what does the scale mean?
A scale means that they remove all the plaque and the tartar and give it a good clean and general scaling of the teeth.
Oh, okay.
Yeah.
We
So,
refer to that just as just a cleaning.
okay. So hygiene, that you call them
Mhm.
hygiene dental appointments, don't you?
Right.
Okay. So if you were looking at X-rays and radiography in band 1, you will be looking at £5 to £40 on top of, this is privately, your £20 to £120. If you're looking at a hygiene clean scale and polish with band 1, again, as I've said, with band 2, you could have a deep scaling, which means that if it's really bad, you would get a really good clean, but it would come under band 2 rather than band 1. But that would be on top of, if you went privately, any X-rays, any new patient consultations or checkups, and the cost of your scale and polish and hygiene and clean. And then there's things like fillings, which comes under band 2 in the NHS, which is £65.20, and that could vary anywhere privately between £30 and £175. However, if you were receiving things like universal credit, income support, and I'll go through these a little bit later on in the slides, council tax benefit, housing benefits, so if you were getting help with your rent or your council tax or anything like that, you wouldn't have to pay for any dental treatment. But if you were a working person and you wanted to be an NHS patient, they're the prices you will be charged. Does that make sense?
Yes.
So they're totally different to the welfare treatments, prices. Okay. So now I'm going to talk about eye tests and optical vouchers. Now, you can find out if you're entitled to a free NHS sight test or an optical voucher to reduce the cost of the glasses or contact lenses. If you're not eligible for NHS funded sight tests or optical vouchers, you'll have to cover the cost yourself. So again, this all depends when you get things like council tax benefit, housing benefit, working tax credit, etc., etc., etc. So on this slide, we've got the things down the what is my left-hand side. You can see it says, if you receive or your partner receives and you're under the age of 20 and you are the dependent of someone receiving income support, income-related employment and support allowance, income-based job seekers allowance, pension credit guarantee, universal credit and meet the criteria, because if you're on universal credit, some in the working category do not qualify for free treatment. If you're entitled to or named on a valid NHS tax credit exemption certificate, this is a type of benefit in the UK where you get tax credits if you are working. So you get a credit for the amount of tax that you would be paying on top of your wages. You have a valid NHS certificate for full help with health costs, that's a HC2. How that works is you can pay yearly or monthly for that, for the NHS certificate for health costs. I think it's somewhere in the region at the moment of about 150 quid a year. You can pay quarterly, but once you've paid that, you've got nothing else to pay. So when you go for your treatment, you show your little card to say that you've got a HC2 certificate, and all your treatment after that, on top of the 150 quid, is free. And also people named on an NHS certificate for partial help with health costs, so that's a HC3, may also get help with the cost of a private site test. Private site tests are free. If you pay for a site test in the UK, sorry, not private site tests are free. We'll start again. NHS eye tests are free. If you pay privately, you're probably looking at about £10 because usually you can find somewhere that they're on offer for a private eye test. You are entitled to a free NHS eye test if you are under the age of 16, age 16, 17 or 18 and in full-time education, are age 60 or over, are registered as partially sighted or blind, have been diagnosed with diabetes or glaucoma, are 40 or over and your mother, father, sibling or child has been diagnosed with glaucoma, or you've been advised by an eye doctor that you are at risk of glaucoma, you are a prisoner on leave from prison, or you're eligible for an NHS complex lens voucher, which your optician can advise about your entitlement to. So it's a little bit muddy in places, but usually people know whether they're entitled to free or not.
But it does sound like a lot of different demographics apply.
Exactly. Yeah. So the vouchers cover the cost of the actual glasses themselves. Okay.
Any type of frame or color, or how does that work?
I'm going to go through that. Okay. So again, all those criteria that I've just mentioned, and I'll leave that slide just for you to have a quick glance at. If you are entitled to any of those, then you will get an NHS optical voucher. I'll just leave that there a second for people to have a look at. Okay, so there are basically the optical vouchers. There are 10 optical voucher values. The value of a voucher ranges from £39.10 to £215.50, depending on the strength of the lenses that you need. So this will be covered by the NHS with one of these vouchers that falls into one of these 10 optical voucher values. Yeah? For clinical reasons, if you need tints or prisms in your glasses, the value of the voucher will be higher to reflect this. If you receive an NHS optical voucher, you're free to take it to any supplier of your choice. So you can go to any optician, have an eye test, and you can take that voucher to any other optician that might be able to offer you different priced frames or lenses based on the stock that they have or how they produce it. Mm-hmm. So just because the person that gives you the eye test does not necessarily mean that you have to go there for the lenses and the frames.
Right, okay.
So if your glasses or contact lenses cost more than the value of your voucher, you just have to pay the difference. So if you wanted to go for a pair of Gucci glasses and you were on optical voucher £39.10 and they were, I don't know, let's say Gucci, £200 for the sake of, you would get the £39 knocked off your £210 voucher, £210 cost.
Okay.
Does that make sense?
Yes.
Cool. Okay, so here are the bands. Voucher A, glasses with single vision lenses with a spherical power of no more than 6 dioptres and a cylindrical power of no more than 2 dioptres. Now this is quite a long list, so bear with me. Right, voucher B, and that's £39.10, is £59.30, glasses with single vision lenses, a spherical power of more than 6 dioptres but no more than 10, and cylindrical power of no more than 6 dioptres with a spherical power of less than 10 dioptres, and cylindrical power of more than 2 dioptres but no more than 6. Hopefully you're following this.
Specific. Oh my goodness.
It is. It really is specific. So the worse your eyesight is, the higher the voucher value is going to be. Yeah. And this is the lenses and the frames. So now we've got voucher C, £86.90. And as you can see, as you go through the 10 sort of levels, the costs increase, but so does the cylindrical power and the dioptries as well. Voucher D has gone up to £196, so that's quite a big step from £86.90 to £196 between vouchers C and D. So this is the worse your eyesight is, the higher the voucher will be to cover the cost.
Right.
Voucher E, £67.50. Now this is talking about bifocal lenses. So that's 2 distinct optical powers. And then voucher F, the difference is the dioptries and the cylindrical power between vouchers E and F. So once you've reached that band from vouchers D and E, you then go on to the bifocals, which covers you for voucher E and F.
Okay.
Yep. Voucher G, glasses with bifocal lenses, and again, the dioptries and the cylindrical power is different. Voucher H, this is prism controlled bifocal lenses. Again, the spherical power and the dioptries has gone up as well. It's not as clear as it could be, really, but I think when you're in the UK and you know how bad your eyesight is and you walk into an optician's, you know roughly how much your voucher is going to cover. Okay, so now we have voucher I and voucher J. Voucher I covers glasses prescribed by the NHS Trust hospitals that do not fall under any of the categories A to H. So anything outside of those brackets, £200.80 will cover the cost of voucher I. Voucher J is a voucher for contact lenses following a prescription issued by an NHS Trust or an NHS Foundation Trust.
Is there a difference between NHS Trust and NHS Foundation Trust?
Not really, except that NHS and opticians are, well, you have the National Health Service. There's no difference between a trust and a foundation trust.
Okay.
The only difference is that some hospitals only offer limited treatments. So if you wanted specific things that a hospital doesn't have, then you would need to go to an NHS trust rather than a foundation trust, because the foundation trust only offers certain treatments.
Okay.
But usually they are not far away from each other. So like our nearest NHS trust is Sheffield. Barnsley is our NHS Foundation Trust, which doesn't offer quite as many treatments as the Sheffield Hospital does, because the Sheffield Hospital is a city hospital, whereas Barnsley's a town.
Gotcha.
Yeah?
Yes.
Okay. You can get a free NHS sight test every 2 years. Just on my letter. Here it is. I'm due for one this year. If you're eligible for a free NHS sight test or the NHS pays for it, you will not be charged. Now, you will get a letter, regardless of whether it's free or not, to remind you that every 2 years, if that's the case, you need to go for your eye test.
On that note, if you say you're not able to go when that letter comes out and you miss that year or even 2 years, the following year, are you then like penalized or anything?
No.
Okay.
But obviously there is a risk that your eyesight might have increased or got worse.
Right.
Which means that your voucher value will be higher if you're paying on the NHS or if you're getting free treatment.
Okay.
Okay. So if you're a child that wears glasses, you're aged over 40, have a history of glaucoma, aged over 70 or over, you can ask for eye tests more frequently, but that would depend on the individual practitioner and optometrist as to whether they think you need it more frequently. If they do, they will make a note on their system, and it will usually be every year rather than every 2 years.
Okay.
Private sight tests, if you're not eligible for a free NHS test, you'll have to pay for a private test. These can vary, as I've said, so shop around. Lots of places I mean, there's a whole row of about 4 opticians in my town that are all side by side. So you can literally walk, and they usually have like posters in the window saying eye test £10 or private eye test free today, or any offers that are on or anything like that, they'll have displayed in the window. You can pay for a private sight test, but you won't be eligible for a free NHS sight test until your next sight test is due. So if you wanted an early sight test, but it turns out that your eyesight hasn't changed, so if, let's say you were called in every 2 years, but you thought, my eyesight could be getting worse, so I'll just check it. If the optician says your eyesight's remain the same, then you'll be charged for the eye test. If the optician says your eyesight's got worse, you won't be charged for the eye test.
Oh, okay.
Yeah. So it depends on whether your eyes are actually have actually got worse or not. But usually 2 years would be the maximum amount of time for an NHS sight test. There we go. That's that. Let me stop sharing. Was that clear as mud?
Yes.
So come on then, tell me all about you. Let's talk about the America.
Oh my gosh, it is messy and there's a lot to it.
Okay.
Okay, so like you said, veterans, military veterans have VA hospitals. Some of them are very, very big. Some of them are quite small. It just depends upon the location. And again, the healthcare there is free, but veterans may have to pay like a small copay, maybe $10 to $15. And then if you need a prescription, they do have a pharmacy there, and you have a small fee usually for the prescriptions.
Oh, I've not even covered prescriptions. I must talk about that.
Right. So if you don't have, if you're not a veteran and you don't have access to that, then we do have, like I said, the welfare insurance. And that's, again, people who don't have a job, if they're a single parent and their kids aren't covered by anything, the state then provides the welfare insurance.
Right.
And I guess the issue with that is it could be considered classist, because that's just saying then poor people aren't able to get really the better healthcare, because a lot of the doctors who accept the welfare insurance have to write off a portion of it with the agreement with the insurance company. So not all doctors want to accept all of that welfare insurance.
Okay, that's interesting.
Yeah, so you see how like a
Yeah.
single mom would say like, well, you know, I only have maybe 2 or 3 doctors to pick from, versus maybe somebody like me who's working and has a better insurance, and I could have maybe 13 doctors to pick from.
You see, here it's quite common for a doctor to do things, especially a general practitioner, and I'm not talking about an optician or an eye tester or anything like that, or a dentist. I'm talking about general practitioners, so doctors that you would go and see for things like colds and sniffles and things like that. They will put things on an NHS prescription to save you paying for it. So, for example, I think at the moment, and I might be wrong, but an NHS prescription is £7.50 per item. So if you've got 3 items, that's 3 times £7.50, right?
Right.
However, sometimes things can work out cheaper to buy privately. So if you are paying for your prescriptions, the chemist might say to you, well, actually, this is £7.50 for an NHS prescription, but we can do this today for £4.50, so it's cheaper to buy privately than it is to buy on the NHS.
Okay. Okay.
But it can also work where a GP might say to you, if they're good GPs, if you pay for your prescriptions, and if you don't pay for your prescriptions, then you get them for free. So they will quite often give you more for your buck. Like instead of giving you 28 days worth, they might give you 56 days worth.
Okay.
Because it's the same price for that one item, no matter how much, they charge. Or they might say, like things like paracetamol, you can pick them up for 28p a packet here.
Okay.
So if you're paying £7.50 for a box of paracetamol, there's a big difference between 28p and £7.50. So they might say to you, I'm not putting that on prescription for you, just buy it over the counter, it'll be cheaper.
Mm-hmm.
So there are, swings and roundabouts as to whether it works out cheaper on the NHS or not. But usually the chemist will advise you when you pick your prescription up whether it's going to work out dearer or cheaper or not.
Okay. Okay. So I had to look. This information seems to be a little dated, but for a family of 4 to have private insurance coverage, it looks like the average cost was between $1,400 and $1,500, and that's a month.
A month?
Yeah, insurance is very expensive here.
And does that come out your wages, or do you have to pay it separately, or?
So the employer, when you start, they will pull that right out, and then they pay. So a lot of times the employer has to pay a large portion of that too, in agreement with the insurance company. So they will maybe pay like maybe like 70%, and then you're paying the rest of that 30%, and that's that $1,400 a month.
Goodness.
Yep, that's a lot, and that's just medical. Then if you have dental, it does go down a little bit. On average, for a family of 4, that's about $360 a year.
A year?
Yeah, a year. So that kind of breaks down to about $50 a month.
Okay.
And then vision, that goes down drastically. That's about $15 a month.
Oh, wow.
Yeah.
So basically here, even if you're working, you can get NHS stuff, but you pay cheaper for it because it's kind of subsidised.
Right.
But over there, if you're working, you're going to get slaughtered, aren't you?
Yeah, pretty much. Yeah.
And what happens if you're not insured?
Okay, so back when President Obama was in office, he made a rule that said you have to have insurance, and if not, you're going to be fined by the government. And
Okay.
everybody was all up in arms because that essentially violates the American Constitution, which says you as an American cannot be forced to have to buy anything. And so they were back and forth, but basically they were appealing it and all this stuff, but it's still a law. You have to have insurance. So if you don't have insurance, you just go to the state and say, hey, I'm not working, or, I'm a family of a single parent with 5 kids and I can't afford it, or, and then you have to prove it with your wages and everything. But then that's when you get the welfare or the state insurance.
Right. And is that a different level of care?
Only because, like I said, the doctors who usually accept the state insurance, they are not as many. And so your options are greatly reduced.
Right. Okay. Okay.
Yeah. And so even with the dental, especially with the dental, there is almost no dentist. I mean, it's very limited. You only have like 1 to 2 options. Well, here in Toledo, anyway, I'm talking about, in Ohio.
You see here, what happens with dentists is if you've not visited after 6 months, they take you off their books. So quite often after, say you needed some kind of emergency treatment, you ring what was your regular dentist and they say, we're not taking NHS patients at the moment. You'll have to go elsewhere.
Oh, wow. So it's a lot of calling around then and kind of shopping. Oh, wow. And especially if it's an emergency or you're in a lot of pain, that's kind of a barrier, it sounds like.
If it's a real emergency, kind of like an abscess that could, go bad, then we do have emergency dentists that are free, but it has to be kind of, you have to go to a doctor first to get it, to say that it's an emergency rather than you can't just turn up. So to make sure you get your NHS dentistry, and you make sure you get it every sort of year,
Mhm.
my advice would be to go at least twice a year, even if you don't need it.
So we have something similar to that here to, again, ensure that you're taking your kids every 6 months, or that you go every 6 months for just the general cleanings. Insurance companies will say, okay, if you go every 6 months, we will cover your cleaning 100%. But if you don't and you lapse that, well, then you have to pay 50% of that and we'll cover the other 50%, or, something like that. It's just different based upon what your insurance policy and your insurance company says. But they have the right to change that up on you if you don't attend every 6 months.
And there's no leeway on that at all.
Mm-mm.
Oh, wow. So let's say you went a couple of days over.
I guess maybe there might be maybe like a week, maybe, but it's not much more than that.
Okay.
And so the dentist office usually are very, very good about scheduling you within that time frame.
Oh, okay. Okay.
Yeah. So prescriptions here can get very, very, very expensive. We do have apps. I don't know if you guys have that. Like a common one here is Good RX. And if you use that app, it'll give you like a scanned barcode. You take that to your pharmacy, and maybe a tablet that would normally cost $127. You scan it with the pharmacist, and maybe it's only $27, and they somehow like write off the rest.
Right. Okay. We don't have things specifically for pharmacies, unless it's what we call an over-the-counter medication. So that would be something like over-the-counter. You see, things like ibuprofen and paracetamol. Paracetamol is free is over the counter, but you would have to pay for it. But paracetamol is generally cheaper anyway. But things like ibuprofen, you have prescription strength, and then you have over-the-counter strength.
Right.
So if you only needed an over-the-counter strength, it's often cheaper to buy over-the-counter than it is on prescription.
We have that too, right?
Yeah.
So like allergy medicines, they call them pain relievers, but that would be, like you said, ibuprofen, Advil, Tylenol.
Yeah.
The low dose.
Yeah.
Right.
But anything stronger, you would just get charged NHS. Well, you would have to go to a doctor and get a prescription, and then get charged the NHS prescription rate of like £7.50 per item. Okay.
Now here, because the drug epidemic is so bad, especially in Ohio, it's a very, very high. I mean, like drug abuse, because you can make, or people can get the recipe to make like meth. Sometimes you just need a couple like Claritin tablets, or I don't know what it is. I don't know what the recipe is, but sometimes the over-the-counter meds are then kept with the pharmacist behind the counter, and you have to request that from the pharmacist.
Right. Okay. You see, we don't have any drugs that are legal.
Oh, that's right. That's right.
We don't have cannabis or methylated spirits, or methadone or anything like that. We don't. I mean, methadone you can only get on prescription. You can't just sort of. You don't. Not that I'm aware of that you can buy it on the street. Not methadone, anyway. You can buy obviously things like heroin on the street, which is a street drug, but
right.
but you have legal street drugs there as well, don't you? So things like cannabis and things are available,
right? So
through the pharmacy.
Certain states have medical marijuana, where you can get a prescription from a doctor, where they'll say maybe you have like chronic pain, or you have maybe like missing a limb or something, and you have to go through with it, a legal doctor, and they have to look at your medical file, and then they will write you a prescription for a certain strain of cannabis and how much. And then they now have dispensaries, medical marijuana dispensaries. So in Ohio, if you have a medical card, you can go to the dispensary. But in Michigan, which is not that far from where I'm at, they have recreational. So even if you don't have a prescription, but you want to take, a cannabis gummy or something just to have a fun night, you can go to that dispensary. But it's limited. You don't have the same access to everything, to all the different products.
Right. So over here, you can buy, is it OCB?
CBD?
CBD, that's it, yeah. Over here, you can buy CBD oil-based products in shops. So things like gummies and things like that, you can buy up to a certain strength.
Okay.
But
Now, CBD is so common here, you can go into the gas station and buy
really,
it. Yeah.
you have to get it from a specific shop here.
Okay. Yeah, that is so common here. But though that's the only like prescription. So anything else, like I was talking about, like making meth, that's illegal. That would be like a street drug. Heroin, that would be like a street drug. But because you can look up online and get access to, how to make that yourself, they keep those products behind with the pharmacy. So you can't go in there and buy a shopping cart full.
I don't know of anybody in the UK that makes methadone on the
That's
street.
good. That's good.
I mean, no, I don't know any. I don't know anywhere. I personally don't know anywhere. Never have. Okay, carry on.
Okay. So, yeah, I think that's really about it. So there's the optical, the dental, the medical, and then we have the prescriptions. I think that really covers it, but we don't have free anything. When I had my kiddos and I had them in the hospital, you get an itemized, we call it an EOB, an explanation of benefits. And it'll say what every charge was for every single thing, how much your insurance company paid for it, and then how much you owe for that.
You have to pay to have children.
Oh, yes. Oh, yes. Pay a lot. So if you have a C-section, which, where they cut your belly open and they pull the baby out, that is going to be a lot more because you're going to have sutures. You're going to have the doctor's time and everything. That's going to cost a lot more than maybe like natural childbirth. But everything you need, any Band-Aid, any type of thing, you get charged every single thing.
You see, over here, you can go privately for a birth. Most people don't. Most people get it through the NHS because they get looked after by midwives, they get looked after by doctors and all that kind of thing. So for births, it's pretty much free here.
Wow.
Unless you choose to go to a private clinic where they might, I mean, even on the NHS, they can induce you, but they wouldn't, let's say you wanted it on the 14th of February, they wouldn't induce you on the NHS on that date.
Okay. Now we have things here too, like where your insurance company may not be what they call in network with the provider, the physician. And so if you go out of network, usually it's not paid for at all, whatever the service is. So you have to really know what hospital or doctor's offices, you have to know where your providers are in network and not.
I can't believe you have to pay for births. I mean, yeah. What about the people that are on welfare? Do they get free births?
Same thing. I think they have to make sure that they go to where is in network, where their doctors, will agree to go. And usually, again, it's most of it's all covered.
Oh, wow. That's mind blowing.
Yeah. So, what was I going to ask you? So I know with it being free healthcare over there, and most people, probably choosing not to go private, is there a really long wait list for most things?
Yes. Mental health, for example, can be up to 2 years.
Oh my gosh.
Yeah. Unless you're at the point where, you need sectioning or something like that. But for a general counselling session, you could be looking at anything up to 2 years.
Now, why do you think that is? Is that just because there's not a lot of therapists and providers, or why is that so different?
I just think it's because mental health in particular is so, there's a lot of people that are going through it, and it's so much more recognized today than it was 20, 30, 40 years ago.
Sure.
And so because there are so many people that need counselling for one reason and another, the waiting lists have gone up.
Now, do you think it's that long because of the pandemic, or was it that way even
It's always been
before?
that long. It's always
Oh,
been that long. I do have to say though, it can be a once you're in the system itself, you don't have to wait for appointments. But to actually get into the system for a referral, that's, you could be waiting for mental health up to 2 years. Once you're
okay.
in the system, appointments could be, you know, weekly, monthly, whatever. But to actually get your first appointment, you could be looking at easily at 2 years.
Wow. Now, let me ask you this question. Do you have to have a referral from your GP, or can you just say, wow, I'm feeling really depressed, I can't shake this, I want to go talk to a therapist?
We have things over here which are called the... We have things over here which are called the community mental health teams. So each community will have its own mental health team. So if you were in a crisis, for example, you would be you could easily phone up the mental health team, the community mental health team, and say, I need to speak to someone. And that's usually a quicker way in than sitting and waiting for your referral appointment.
Okay.
So if things become so bad that you need to see someone urgently, the way to do it is to go through the community mental health team, who will have you assessed. The other way that you can do it is to go to A&E, and they will also assess you. So if you were, for example, feeling suicidal, they would generally get you in a lot quicker than, you know, if you just needed, I know this sounds awful, but, you know, something like grief counselling or, you know, something like that.
Okay. Okay. So here, I mean, again, I'm in a big city, but there really is no wait time. Now, because I am a mental health therapist, I know that right now, because of the pandemic, there is a little bit of a wait for couples counseling, because so many people are stuck home with each other when we had to quarantine, and kind of realized, like, you're really getting on my nerves and I can't stand you. So it's really, really hard to get a couples therapist right now, but for individual therapy, you just pick up the phone of, if you want to go to a community mental health agency, or if you want to go to like a private practice, you can really pick, again, based on your insurance, where you go. You can usually pick your own therapist too. A lot of the agencies will have, like the agency where I work, they have a picture of the therapist and like a bio. So you can kind of read through and see, like, oh yeah, I think, you know, this person has a history or a specialty in dealing with this demographic or that demographic. I think I want to, you know, wait for this person to have an opening or something.
If you were paying privately, you could probably get in the next day.
Okay.
Yeah. Yeah. What was I going to say? I also have to say, it can be a bit of a postcode lottery depending on the quality of the service. I actually find that Barnsley's mental health services are excellent. But Tracy, for example, that lives in Lincolnshire, she's had really bad experiences with her NHS mental health services. And even down to the treatment, you know, it's totally a postcode lottery. Depending on whereabouts in the UK you live, will depend on the types of treatment and how good the service is.
Okay. Now, is that just based upon maybe the therapist's lack of experience, or the specific agency?
It's usually based upon the NHS Trust or the NHS Foundation's mental health services that they offer and the teams that they have.
Okay. Now, if you say postal code, is that what
Like a
we
zip
would?
code.
Yeah. Is that like what we would say here, like the inner city or like the ghetto. So would maybe have like not the best care versus maybe like in the city or a
I don't know.
surrounding
I
city.
don't. I don't think so because Barnsley's a town and Lincoln's a city,
Okay.
and our mental health services are much better than Lincoln's mental health services are. So it really does boil down to how competent your NHS trust is.
Hmm. Now, if let's say Trace wanted to come to Barnsley, but that's not what, she's not in that zip code and that's not what's on her, maybe her driver's license, is she still able to make that drive if she wishes?
If she wishes, yes, she can. You could use
Okay.
any NHS services anywhere in the UK if you're willing to travel.
Okay. Okay. Now, see here, you have to be careful because, again, let's say I wanted to find a doctor up in Michigan, which is only maybe 10 minutes because I live so close to the border. You have to make sure that your doctor is in network with them, because if I would go, let's say 5 sessions and realize, oh, I got an EOB form in the mail, and they say, oh, this doctor's not, in network, I then have to cover all of that.
Oh, wow.
Yeah. So you have to make sure you find out where the doctor you're going is and if they're in that network.
That's where we're lucky, you see, because our National Health Service really is a National Health Service. The only difference is the quality of the service you receive can vary depending on your area.
Right. Right. So interesting.
So it's free at the point of use. They also have something over here which the paramedics adhere to, and that is wherever possible, what the paramedics, ambulance service, fire crews, police, wherever possible, to save lives.
Okay.
So regardless of whether you're paying or not, they will always, unless you have what's called a do not resuscitate kind of order, they will always save your life.
Now here, a paramedic or an ambulance, if you're able to answer, where do you want us to take you? Because again, they want to make sure that they're trying to go in network. So they'll ensure that they're going to get paid. They'll ask you, but if it's an emergency, a car accident, and you can't speak, they'll take you to the closest one.
You have to pay for your ambulance service?
Yes, they're very expensive.
Goodness.
So most people try not to call unless it is a very serious injury to have to need that, because it is very expensive.
So if you're having a heart attack, you'd have to pay for your ambulance to get you to hospital?
Absolutely.
Oh my goodness.
but,
That's just
but hopefully you have a good insurance plan that it's covered under.
That's just crazy. Absolutely unbelievable. So these are the differences. Are we covered? Have we done everything we covered? Yeah.
I think so. Oh, one last thing.
Okay.
Talk to me, because of the difference in the drugs. Talk to me about your GP's prescribing maybe Percocets or Vicodin for pain.
Okay. It's well known that there are certain drug companies that will encourage a GP through, I wouldn't say favours, they might persuade them. I don't know how. I can't think of how they do it, but it is well known that it does happen. So it might be that a certain drug company comes to like a representative of that drug company or that pharmacy comes to the GP practice and says, hi, I'm here with my medical stash that I've got, and I just want to show you what I've got so you can have a look. And sometimes they might be a little bit more persuasive about prescribing certain drugs rather than others, which may or may not be more beneficial.
Okay.
Generally,
those doctors can't prescribe that type of stuff, though, the pain pills?
Oh, yeah.
Okay.
Yeah. Oh, yeah. Yeah, I mean, Yeah, prescription strengths. Yeah, they can prescribe it. Yeah.
Okay.
Even like if you really needed it, like, you know, hospital strength, if you needed that kind of. The only thing here is if it's something like let's think, what's the really strong painkiller?
Morphine?
Yeah, if it's something like morphine, you have to have a certificate from your doctor to say that you are able to be prescribed it.
Okay.
So the
Okay.
chemist will know when you go to get the prescription that you have been, especially if it's really strong, that you have been prescribed this strength of morphine, and you will have like a little card to say that you're entitled to it.
Okay. So here, because again, especially in Ohio, the drug population is so bad, they've had to put so many different features into place. So for example, on the prescription pad, it's got a watermark on it, so people can't try and duplicate it. You cannot just have, maybe let's say you have a bad back and you have a prescription for Vicodin. You really are not supposed to be walking around with that in your pocket. It needs to be in the bottle, and the bottle has to have your name on it. You have to, only you can be the person to pick that prescription up. You can't have other people do that for you. You have to show a photo ID and you have to sign for it. They put all these measures in place to try and stop some of the underhanded, illegal drug use and selling from going on.
There are certain instances where anyone can pick up a prescription for you, providing they've got like proof of who they are, and they know your address,
Okay.
and they know your name, and they know your date of birth. If it comes down to strong painkillers like morphine, then they are allowed to pick it up for you, but they would need to be presenting the certificate with your name on it to say that they were entitled to do so.
Okay. Okay. All right. I think that's all the questions I had.
Well, it's been really interesting, Beth. I've really enjoyed it tonight. It's been. I'd be interested to see what our subscribers, both on Facebook and YouTube, have to say about it. Don't forget, do push that like button and push that subscription bell if you are on YouTube to subscribe to our channel. Do give us a thumbs up if you've enjoyed the video, and if you haven't, give us a thumbs down, but please don't. Anyway, I'm going to say my good nights and then leave Beth to say hers. So I'm going now. Goodbye.
Goodbye from America. Are you tired?
Not really. I was in bed early. I was in bed by 3:30.
Oh.
Let me change my name. Change my name.
Megacast TV, your channel of choice. Please like, share, and subscribe.